Good morning, everyone, and thanks for joining us for QI Power Hour on this Friday morning. This is Chelsea Schwartz from the Saskatchewan Health Quality Council, joining you from Saskatoon this morning. For those of you joining us for QI Power Hour the first time, QI Power Hour is a free monthly webinar learning series hosted by the Health Quality Council here in Saskatchewan. We bring together improvers from a variety of sectors with an interest in improving health to learn about quality improvement related topics. All of our sessions are recorded and available on the HQC website following the event, so feel free to share these recordings with colleagues who aren't able to join us in person today. And feel free to check out sessions of past sessions that you may have missed. While you're on the HQC website, we invite you to sign up for our distribution list to ensure that you receive regular invites to all of our upcoming QI Power Hour sessions. Over the last year, we've been excited to see the continued growth of QI Power Hour throughout our home province of Saskatchewan, throughout Canada, and even nationally. So again, I'd just like to take the opportunity to welcome everyone to QI Power Hour, and thank you for spending your time with us and your commitment to your ongoing learning to improve the systems that you are each part of. So just some quick onboarding in terms of how you can participate on the call today. So we encourage folks to share their questions and insights during the session by making use of the chat function. So you can access the chat function by clicking on the bubble icon that appears towards the bottom of your screen when you hover over it. And we encourage you to send your questions, comments, and ideas to everyone in the chat so that everyone can participate on the conversation. So I'll invite everyone to just test out this function before we get started. So let's take a moment to practice this by typing in the name of the organization that you're joining us from today. Great, thanks. Welcome, Jamie, joining from the Saskatchewan Health Authority, Health Quality Council here at Innovation Place. Perfect, Choosing Wisely Saskatchewan. Excellent, so it looks like folks are getting the hang of it. They found that chat function. Welcome, everyone. Another way that we invite you to participate on the call this morning is by joining in the conversation through Twitter. So you can use the hashtag QI Power Hour and the handles HQC Sask, as well as our guest speaker today, Charles Plante, who goes by the handle of Chuck PL. So with that, let's dive into our session today. I'm delighted to welcome our presenter for today's session. Charles Plante is a PhD candidate at McGill University and the former policy director of Upstream, Institute for a Healthy Society. He is the lead author of Poverty Costs Saskatchewan, a new approach to prosperity for all, and co-author of Combating Poverty, Quebec's Pursuit to a Distinctive Welfare, as well as several other reports and academic articles. He is currently a researcher at the Urban Public Health Network and based out of the Department of Community Health and Epidemiology at the University of Saskatchewan. And this fall, he will be transitioning to the Johnson Shayoma Graduate School of Public Policy as the Houston Family Research Fellow in Health and Social Inequality. Welcome, Chuck, and thanks for joining us today for our session.
Thanks for having me, Chelsea. And thank you to HQC for providing me with this opportunity to talk about the cost of poverty in Saskatchewan and some of the work that I've done in this area. Today I'm going to talk about for about 30 minutes, maybe a bit less, and it's going to proceed in about 3 sections. I'm going to start out by talking about a little bit about the poverty cost campaign that I was a part of a few years ago and why we got into calculating the cost of poverty to begin with. I'm going to then get into some details about what goes into our calculations when we calculate them, and then I'll close with a sort of a cursory review of some of my thoughts around how these numbers can inform policy and practice. It's going to be a real bird's eye view, and I'll be very interested in questions that people have afterwards, and happy to get into more detail in the areas that people are interested in after I'm done presenting. So just to kind of get us started, I was going through a lot of my different documents and things that I've written on this in the past, and this particular phrase stood out to me. This idea that all too often when we think about interventions that we enact to alleviate poverty, we frame them as all cost and no benefit. And when we started talking about the cost of poverty a few years ago, one of the main things that we wanted to bring out and bring to the fore was this point that poverty is something that was extremely expensive, and that by dealing with poverty, it wasn't just a money thing. It could also be something that was generative, that that actually generated a return and actually created a lot of benefit. So to get to that point, when we talk about poverty costs and the cost of poverty, other points that we're trying to emphasize are that poverty costs individuals. I think most people recognize that the poor are damaged by poverty, but it's also really expensive to society as a whole. And when we don't do anything about poverty, when we don't address it, it can become incredibly expensive, not just for those individuals, but for everyone at large. In addition to that, it's also just another way of thinking about a pressing problem. Poverty is important for moral reasons and for justice reasons, and talking about the cost of poverty doesn't negate that. It's just another way of thinking about it. In the past, I've often said there's sort of like, people can be moved by sort of two types of arguments, moral and economic arguments. And so this is sort of, talking about the cost of poverty brings out those economic arguments, but it's really not necessarily supposed to supplant it, moral arguments. So back in 2014, I calculated the cost of poverty. We assembled a team to talk about the cost of poverty in Saskatchewan. And I was, because of my background and expertise, I was the one that led the calculation side of things. And we calculated the cost of poverty for 2010. The Poverty Cost Campaign came out of work that had been done previously in the community, a lot of work by the SPRP and other local partners to raise awareness about poverty. They had found that they had a lot of people interested in the issues. They'd done these food bank challenges where they had people live for a month on food bank rations and to see how hard that was, or to try to survive on my social assistance levels. But a lot of the time people were coming and sort of saying what's next, or policymakers were saying, well, we can't necessarily afford to do anything about it. So again, it wasn't just another approach, but there was also a practical need to bring another perspective to thinking about poverty in the province. And that was sort of what motivated this. In addition, at the time, Saskatchewan didn't yet have a poverty reduction strategy, and so that was really the main ask of the campaign. So we used poverty costs as an opportunity to get people talking about poverty and the numbers that we generated to get people talking about poverty, but also to get people thinking about what could be done next. So in order to calculate the cost, we used a method called that's sort of informally referred to as the Laurie method, after a researcher that worked with the Ontario Association of Food Banks back in the late aughts, around 2007, who developed this method for calculating the cost of poverty in Canada as a whole and in Ontario. Since that time, these costs of poverty have been estimated for pretty much every province. Saskatchewan was kind of late to the game, actually. I think we were the 8th to calculate the cost of poverty for. But basically, the gist of the method is that it strives to calculate the cost of poverty as well as we can using the data that we have available to us. As is always the case whenever we're doing these types of exercises, better data could allow us to improve it. I need to switch slides here. So what the Laurie method essentially asks is, what would the savings and gains be if we raise the standard of living of the poor, to the level achieved by the second income quintile, or roughly the people at the middle of society. What we end up doing when we calculate the Laurie method is that we look at a bunch of different outcomes, and I'll talk about those outcomes in a second, and we end up comparing the outcomes of low-income groups and more middle-income groups, and we assign monetary values to those differences, and then we add those up to get our total costs. And so the Laurie method considers 3 different categories of costs that are referred to as remedial costs, opportunity costs, and intergenerational costs. Remedial costs are the direct costs associated with treating the damage caused by poverty, and I'll talk a bit about more detail about that. But it's built on this idea that when people are poor, it causes them degradation, and society has to make investments to treat that degradation. Opportunity costs refer to a more indirect category of costs that's associated with the opportunities that people miss when they're poor. And basically, when people are poor, and I'll talk about this again a little bit more, I'll provide an example in a minute. When people are poor, it costs money to participate in society when you don't have the resources that you need. You end up missing social opportunities, but you also end up missing economic opportunities, and that can be really expensive to the economy as a whole. Finally, intergenerational costs refer to the sort of lasting impacts, both in terms of direct and indirect costs, that result in, over the lifetime, people that have experienced poverty are less likely to be able to realize their full potential in life, particularly children that have grown up in poverty. So, expanding a bit on what I'm talking about when we talk about remedial costs, the method considers two primary categories of costs: health costs and crime costs. And this reflects the idea that poverty places a disproportionate burden on the health of the poor and ultimately the health system. On the right there, I've got a table that sort of shows some of the research that we used to calculate this number. Past research has looked at health system usage, disproportionate health system usage by income quintile in Canada, and previously in Manitoba in the muster study. I mentioned earlier that as we get better data, we're able to improve our calculations. In the past and in the initial Laurie method, the estimates were calculated based on numbers that were based on research that was done for Manitoba. More recently, we've been able to benefit from research that's been done by the Public Health Agency of Canada that's looked at this distribution for the entire country. The crime cost, in addition to there being additional health costs, in addition to the damage that poverty causes people's bodies, it can also damage them, their social relationships in the communities and the cohesiveness of communities. And this can often lead to increased crime costs, both in terms of individuals being more likely to become caught up in the criminal justice system, but also the poor are quite a bit more likely to become victims of crime as well. So that's important to always keep in mind. After remedial costs, so we can talk a little bit more about opportunity costs. And so opportunity costs, when you think about opportunity costs, just to pick up on that again, we're talking about these missed opportunities, the fact that people aren't able to participate in society. Oftentimes we think of that in terms of economic. As a society, like we really, especially a modern and advanced industrialized and post-industrialized economy, a lot of our wealth comes from our human capital and the well-being of our people and the intelligence and abilities of our populations. And poverty causes as already mentioned, the degradation of that, but it also prevents people from being able to fully integrate. And so a really tangible example of that might be an individual whose income is so low that who's so poor that they're unable to afford a bus pass to be able to get to work, and that ends up passing on costs to employers and to the economy as a whole. Or another example might be a young mother who is unable to afford the cost of childcare so that she can continue to participate in the labor market and contribute to the economy as she might like to, but can't afford because of her poverty. In addition to there being that sort of direct earnings cost, there's also revenue costs. And so in the Laurie method, they also emphasize the point that it's not just that there's lower productivity, but when there's lower productivity, there's also less revenue for the state. In the Laurie method, they differentiate between private versus social costs, and they sort of talk about the foregone earnings and productivity as being private costs, and the foregone state revenue as being social costs. I don't personally love that distinction because I think, in our society, we talk a lot about GDP as being a really important indicator, and we use it all the time to evaluate ourselves and how we're doing. And productivity is an integral, and earnings are an integral factor that determine GDP. And so there's this direct relationship between poverty, earnings, and subsequently, GDP. Moving on, intergenerational costs, as they were initially conceived, relate to the fact that children who grew up in poverty are a lot more likely to end up living in poverty as adults, but they're also a lot less likely to end up in higher income levels and achieve higher levels of achievement. And so in order to calculate the intergenerational costs, we work with research by the economist Miles Korak, who's looked at this throughout the country, done some really impressive research on intergenerational mobility in Canada. And we essentially asked the question, how much more would the lowest income quintile have achieved in life if they had been able to reach similar heights as individuals from higher income quintiles? And this ends up reflecting both damage and missed opportunities that I spoke before. This is a figure. On this slide, I have a figure that that I pulled from the Poverty Cost campaign. So when we calculated them in 2014 for 2010, we estimated that the cost of poverty in Saskatchewan at that time were about $3.8 billion each year. That this reflected roughly $420 million in heightened healthcare costs, $50 to $120 million in additional increased spending in the criminal justice system, $2.6 billion in lost contributions to GDP and taxes, and another $720 million in increased social assistance spending. I'll talk a bit about social assistance spending in a minute, but this is just to give you an overall view of what we came up last time. More recently, I've been able to update the costs and recalculate them using a method that I've been working on with Iglika Ivanova, who's an economist in Vancouver, who sort of spearheaded the poverty cost calculations for BC several years ago. We've been working on improving the method and recalculating the cost of poverty, not just up to 2010, but all the way up to the present, to 2016. So I won't get into too much detail about how we've changed things. We're still working with the same three categories of costs and a lot of the same information. One difference is how we've been treating social assistance costs. But ultimately, we're getting estimates that show that the costs of poverty are very similar today to what they were previously in Saskatchewan. And we're still looking at it costing around 4.5% to 5% of GDP, around $3.8 billion a year. Or another way of thinking about that is in per capita terms, costing upwards of $3,000 per citizen annually. That includes children. So just a general summary of the key empirical findings that we've been finding. The costs of poverty are large and prohibitive. Even though there's some error in our measures, there's no suggestion that the costs are small. It's like what I like to say. It's very clear that they're large. We see that the most pronounced costs obviously relate to the opportunity cost of poverty, and that place a real drag on the Saskatchewan economy. But it's also notable that, for example, the health costs of poverty are on the order of $500 million, we estimate them to be. And when you think about the overall budget of the Ministry of Health being about, $5.36 billion, $500 million is a lot. The other point, I have actually done calculations for the rest of the country, and Saskatchewan's cost of poverty are slightly below the national average. This is largely because Saskatchewan does have, using most of the leading ways that we calculate poverty in Canada, slightly lower levels of poverty, although this can change. And it has changed over time. Poverty, I think, has gone up in more recent years in Saskatchewan since the last time I looked at these numbers. So moving on to thinking about, what do the costs of poverty suggest for policy and practice? One of my favorite types of policies and solutions are the things that, sometimes the right thing to do is also the smart thing to do. What I love about when I calculate the cost of poverty is I find that we're able to see more clearly when these two objectives align and real opportunities start to emerge. So as I promised, one thing that we can think about differently when we start thinking about the cost of poverty is social assistance. We can start seeing it more as a social investment. We can think of social assistance as something that if we think about it as charity, there's more of an inclination to say that, well, that's something that we'll spend money on when we can afford it. But when we can't afford it, we don't want to spend money on it. But when you start emphasizing the cost and start thinking about things in terms of cost and benefits, we can also think of social assistance as an investment. In the case of our numbers the cost of poverty suggests an upper limit on how much we can afford to spend to reduce poverty before we, maybe it could be said that we're only spending on social assistance for charitable reasons. And at this point, we're nowhere near that threshold. In Canada as a whole, we invest, much less than 5 to 7. We invest on the order of 5 to 7% of the total cost of poverty on social assistance, and so we've got a long ways to go before we have to start worrying about spending more than poverty, spending more to remedy poverty than poverty is costing us. The other nice thing about making these costs explicit is once we start calculating the costs, we can start asking the question, which policies and interventions are most efficient at reducing the cost of poverty. I talked a little bit how I calculated the cost of poverty, or how we do that. It's useful to stress because it reorients how we think about spending on poverty. A lot of the time we tend to oversimplify how we approach poverty alleviation and think about solving poverty in terms of just providing people with income. But really, when we start talking about the cost of poverty, we're not actually looking at people's incomes per se. We're looking at their outcomes in terms of health and justice and economics. And the policies that are going to be most effective at reducing poverty, reducing the cost of poverty, are going to be those that narrow the gap in outcomes between people with low incomes or people that are poor and the middle of society. And so sometimes we might find that investments in programs and services could be more effective than direct income transfers. Of course, and people might have questions about the methodology afterwards. There's a lot we could do to improve our cost of poverty estimates. As you may have noticed, when we did our numbers in 2014, we had to calculate them for 2010 because that was what we had. That was when we had data for about 5 to 6 years ago. Today, the turnaround's a little bit faster. I'm able to calculate up to 2016 and 2019, and I should be able to do up to 2017 in the next month or two. But I'm still operating 2 years after the fact, with data 2 years after the fact. Additionally, if you dive into the numbers quite a bit, the measures are not as sensitive as they could be to regional variation and variation within regions over time. So, for example, I mentioned earlier that our health costs are done, based on a national tabulation done by FAC. But for example, ideally, we would be able to work with Saskatchewan-specific numbers that could be tabulated by an organization like HQC, nudge, nudge. They could regularly report on the associations between health system usage and income in Saskatchewan and assign dollar values to these. That would make my day. LORI also, the LORI method also covers most costs, but it could probably cover more costs. So there's opportunities in the future to explore those. Just finally, looking ahead, there was a whole round of cost of poverty calculations that were done in Canada, sort of culminating in the Saskatchewan work in 2014. More recently, I've been in talks with a number of partners at the national level and in various provinces about updating these numbers for the country and for all the provinces. And so Upstream has been sort of leading that with other partners at the national level, like the Campaign 2000 Coalition, as well as Dignity for All. And we're expecting to be able to put something out within the next half a year. Really excited about that. More locally, there's lots of plans going on and interest still around the cost of poverty in Saskatoon. The SPRP, the Saskatchewan Poverty Reduction Partnership, sort of been leading the way in unpacking and understanding poverty locally, as well as the Community University Institute for Social Research, QUISR, has been doing some very interesting work around social return on investment, which is kind of a different but related concept to the cost of poverty. It's very interesting work that they've been coming out with recently, and I strongly recommend people take a look at it. But yeah, just in general, just to close, it's been a pleasure talking, and I look forward to your questions. I pulled this directly from the QUISR report that I was reviewing recently. It's a quote from the Canadian Institute of Diversity and Inclusion, but this idea that it's a nice place to leave it. What gets measured gets done, and really ultimately with the cost of poverty work that we're doing, it's all about getting numbers and measures in order to mobilize and motivate action on poverty, which is a topic that's near and dear to all of us working in the field. So thanks very much.
Perfect. Well, I've been excited to see that the questions are already coming through. So this leads me to believe that we may have more questions than we have time to answer today, which is an exciting space to be in. I'm glad that everyone's so engaged in this topic. So I just do want to mention that this is Chuck's contact information. If we don't get to your question, he has extended the offer that he'd be happy to hear from you. So these are the ways that you can reach out to him. So we'll just backtrack here a little bit and get to some of your questions. So to the point of being slightly below average, but can change, this was on one of your earlier slides, do we know the birth rates in the 5 different groups, as that could be forecasted with the other slide above childhood? So I think that this had to do with, let's see if we can find this slide here. I think this guy here.
Yeah, so I didn't get too much into the nuts and bolts of how we calculate, like how we specifically calculate and the costs in each category. But in effect, we work with these numbers, with this information, and we weight it by the number of children living in poverty or in the first income quintile at the point in time that we're calculating the cost of poverty. So that implicitly accounts for the uneven distribution of children across quintiles.
Perfect. Thanks for clarifying. So another question from Jocelyn LeBlond. Why is the cost of poverty in Saskatchewan a bit lower than the Canadian average? What are some of the factors that you think contribute to this?
Yeah, I didn't want to dwell on that too much. In recent years, poverty rates have been lower in Saskatchewan, but that is also it's also a bit of an artifact of how we calculate poverty in Canada. And the fact that in the past, our measures, especially in the past, our measures of poverty in Canada have excluded a sizable chunk of our Indigenous populations because they live on reserve or they'd maintain their primary address on reserve. More recently, we've seen numbers based on tax filer data that include those populations, and Saskatchewan doesn't look nearly as favorably compared to the national average. And so I suspect that going forward, as we start using that data more and more, Saskatchewan might not be below the national average anymore.
Yeah, that's a great factor to keep in mind, that that's one of the things that it's not necessarily capturing or reflecting.
The other aspect of this is because of the way that we calculate the costs right now, because of the information that we have available for us, it's not as sensitive as it could be to regional variation. And so when I calculate the health cost of poverty, I'm working with national level differences in the health system usage between different income groups. If I had Saskatchewan specific numbers, and I would be able to say more accurately whether that is a disproportionate issue in Saskatchewan versus the rest of the country. And there'd be a lot more opportunity to make more meaningful comparisons between the provinces and the national average. But so again, I don't want to dwell too much on that difference.
Yeah, excellent. Good to know. Are there any plans or interests to make a return on investment calculator where one could input how much they save if they invest a certain amount of money in poverty reduction?
I think that's the type of thing that Quasar is working toward, and that's why I kind of wanted to plug them at the end of it. I don't have that plan for me personally to do that right now, but it's definitely like one of the things that really, one of the reasons I've been motivated to talk about the cost of poverty in the past as like a researcher and an analyst, is I think once you get that done, then it like opens the door to the next thing, and I think this is definitely one of the next steps to do in this.
Absolutely. So essentially what you've created is kind of a platform for ongoing discussion, right? It's great to get as a first foray into the conversation to get people interested, and now, you know, as there's interest, we can take the next steps forward in making that information more sensitive and exploring different facets of it. So a couple of questions that have been popped in through a different format here. Can you speak a bit more about what you think policymakers should do and what we as health professionals should do in terms of political action to help influence these policies?
So I think I kind of already spoke about a little bit in terms of like a couple times already, and as an analyst and a researcher, like I'm always gonna, I was joking with Chelsea when we were preparing for this, that my ask is always gonna be data related, and so I'm sure if you talk to an advocate, you know, even somebody else that works on the Poverty Costs cost campaign, they'll have more concrete policy recommendations in terms of services and programs. But because my area and the place that I focus my attention the most is the data that we have and the evidence that we have, I think there are some real opportunities to become more fine-grained in our analysis of the costs of poverty in Saskatchewan. The methods are all there, and the data's all there. It's just really a matter of deciding that this is something that we want to track and work with. And I do think, talking about SROI, this is all stuff that's, really feasible. This could become a big part of how we think about and evaluate policy interventions in Saskatchewan or anywhere else in Canada. We have all the tools, or at least we have the data. We have all the things that we need. We have all the ingredients that we need. Maybe they just need to be put together in some places. More generally, though, I did speak a bit to this. It's really important to not confuse public spending. It's not just assume that every dollar that's spent on programs and services is charity, and that it's just a loss. It's like we've written that money off. One of the other major points that we're trying to emphasize in talking about the cost of poverty, and you can do this in other areas of spending as well, is to stress that in a lot of cases the social spending is really actually investment. We're saving ourselves a lot of money in the long run. Economists have a term for this called false economy. It's just this idea that if I save some money here, I might actually end up costing myself more money in the long term. And really, governments and service providers are they really should be taking the long term in mind. It's one thing if a private business needs to keep itself afloat and is going to think more short term, but governments really do need to be taking a long-term perspective and thinking about cost benefits over the long term.
Great, thank you. So this might be a question that's maybe more near and dear to your heart, as it's speaking of measurement, but any thoughts on your suggestions for measuring the impact of policy work related to poverty?
I mean, my PhD dissertation is in poverty measurement.
Oh, there we are.
We won't go too far down that rabbit hole. But I think in terms of if we were doing regular updating in terms of looking at inequalities and looking at how I've talked a lot about the health system because I have a health audience, and I'm sitting here at HQC who has the data to do some of this work for that sector or for that area of spending. We can do the same in the criminal justice system. I know Saskatchewan's in the criminal justice system has taken some leadership in terms of working with data in ways that haven't been done before in other places in Canada. And I think they actually have a lot of the data infrastructure built to also be able to do this type of work for those systems. It really just means regular monitoring of inequalities in the system usage. And then if you're doing that regular monitoring, then when you do interventions and stuff, you can actually study whether or not those inequalities are changing over time. A lot of my other research, the main project that I'll be pursuing with the JSG, with the Johnson Sheroma School of Graduate School of Public Policy in the next couple of years is looking at health inequalities specifically, not system usage, but just outcomes, just health outcomes, specifically mortality actually. But what we're finding in that research is that there's huge variation in inequalities. It's the difference between the health system usage of the first income quintile and the second and the third and the fourth and the fifth is highly variable among provinces, but even within cities. And the next steps are really to really understand that, to monitor that on a regular basis. And the more that we monitor on a regular basis, the more we can start asking questions like what's causing that variation, and start unpacking that and looking at seeing, what are the policies that are affecting that.
Right, yeah, drilling down in the data to help understand what the potential interventions could look like for some of those.
Yeah.
Any thoughts on basic minimum income or guaranteed minimum income?
I mean, I have lots of thoughts, but I'm just pausing to try to come up with a more concise answer. So, as a general rule, income is really important, and more income. We don't set social assistance rates very high in Canada, and more income is probably better for a lot of people. And there's interesting research from the developing world over the last 20 years that shows the value of cash transfers and the impact that it can have. That being said, I don't think that income is necessarily a solve-all, and I've deliberately talked about programs and services as interventions throughout my talk because I think there's a lot of value in sometimes developing, basically providing people not just with income but greater capability by providing them with services. And so just an example of that would be like the difference between the Canadian child tax benefit versus like a nationally affordable childcare provider. It's not clear to me that that's a one-to-one, and I suspect the latter might be able to generate more efficiency, especially if you start getting into these numbers and stuff. And if we could do those sort of cost-benefit analysis, and I think the actually thinking about the cost of poverty actually opens us up to considering more beyond basic income, because there's a tendency sometimes when we just think about poverty in terms of poverty, and we often measure poverty in terms of income, to think that we could eliminate poverty by increasing everybody's income. I suspect, though, that even if we increase people's income and brought them above the poverty line, we would still see large differences in a number of health and crime outcomes, because health isn't just determined by income, and social participation and inclusion is not just determined by income. But again, incomes could be higher. I don't want to say that we shouldn't increase social assistance rates, because it would probably reduce things somewhat. What's nice is that working with data, we could theoretically answer these questions empirically for Saskatchewan.
Thank you. Another question from the chat. Have you had the opportunity to brief the political parties in Saskatchewan of your work direction, and what have been their comments?
Well, when we did the Poverty Costs campaign, we worked really closely. We met a lot with government, and it was really great. And they were very open and interested in what we were talking about, now I'm more of an academic researcher, so I don't really talk to politicians very much, except like informally. So not lately. Although I'm sure that I know the more like in some of the work that we're doing at the national level to try and recalculate these numbers for the country and the various provinces. Again, I'm the researcher on the team, so I don't personally do that much meeting with politicians and others. But I know that other people in the wider group are probably scheduling those conversations, and that's definitely the plan.
Excellent. A question that burbles to my mind. I'm interested in from your deep diving into some of the data. Do you have a sense of where to maximize advocacy efforts in terms of, is there more potential for investment and action at kind of the municipal level or a community-based level versus a political or a provincial level versus a national level, or do you see kind of distinctive roles for each one of those partners?
Yeah, it's interesting. Just because of the way that we've organized Canadian society, literally quoting the Constitution, the way that we've distributed the powers, a lot of the decision-making around social policy is made at the provincial level. And so actually when we started with the Poverty Costs campaign, our desire was to talk about, it came out of the SPRP and like a Saskatoon group. But we eventually realized that what we needed was a provincial poverty reduction strategy, and ended up becoming more of a provincial campaign, because that was where the decision makers were. That being said, I've also found in a lot of my other work, especially lately, I've been working more on outcomes at the city level. In the past, we've had a real challenge in terms of doing numbers at the city level. So a lot of my more academic research right now is actually about innovating and figuring out how to do a lot of different research that we've traditionally done in Canada at the provincial or national level, at the city level, and start telling that city-specific story. And what we've been finding, for example, with health inequalities is that there's as much variation in health inequalities between cities within Ontario as there is between cities across the country. Like the highest inequalities are in one city in Ontario and the lowest in another city in the country. Okay, which suggests that there's a lot going on in terms of determining these types of outcomes at that level. As we start to see that, we can probably start imagining more about what's actually happening and how decision processes are actually operate and affect outcomes at lower levels than the province. But also, what's also been really exciting and interesting about that work is there's something about when you talk to people about their cities, it like connects in a way that like provinces don't necessarily connect in their imaginations. You start to realize that people actually live and experience their world at the city level or the community level, and that the province is almost, it's sort of an artificial construct, right? Like it exists on paper and we've built, we've organized our state around it, but it doesn't necessarily, it's not necessarily concrete to people in the way that their neighborhood is.
Right, doesn't necessarily trigger the same level of engagement perhaps or interest or ownership.
Exactly. People are really engaged and there's a lot of interest in ownership when you start talking about city level outcomes. But there's that, I mean, we're really in a good place in history right now because we've got data now that, and the processing power to actually do city level analysis in ways that really wasn't that feasible 10 years ago even, so. And that's kind of where some of my work is going. Not my poverty costs work, but other work that I have going, yeah.
Great, well, we've got through a number of questions. I'm delighted to see that. So I'll welcome questions to come in. We have a few more minutes left with Chuck. In the meantime, I am just going to offer a few kind of wrap-up notes here. So right before we got started, I offered Chuck a new pair of lovely I Love QI socks that I know that he will be delighted to wear. He's giving me the thumbs up sign here. So we'll look forward to seeing those on your Twitter feed over the next couple of months. It feels a lot more natural to give you a pair of socks now in the fall than it did even to our July speaker because
I don't think I've worn socks in like 3 months.
Yeah. They'll come in handier as we progress. Oh, good old Saskatchewan winter. So if you too would like to get your hands on a pair of these highly coveted socks, we invite you to become a QI Power Hour speaker. So Caroline is just sharing out the link in the chat now. So we welcome you if you have an idea that you think would be of interest to our community of learners here on QI Power Hour. We always welcome those ideas. I do just want to make a plug for our next upcoming session. So as you know, this is a monthly offering offered by the Health Quality Council. So our next offering is Friday, October 25th with Dr. Taryn Kadapali. He'll be talking to us about some of his work within the digital approaches to population health crises. Out of the internet-connected devices we use, smartphones are the most versatile and pervasive tools, and it's estimated that there will be 6 billion smartphones in circulation by the end of 2020. Given how pervasive this technology has become, researchers are asking, how can we transform the use of smartphones to fill critical data gaps in the research world? Citizen science uses the structure of community-based participatory research to take local approaches of problem solving to a global scale. With his research team, Dr. Kadapali is using citizen science platforms to support population health surveillance, integrated knowledge translation, and policy interventions. So if that is a topic that is of interest to you, we'd love for you to join us on October 25th. Quick scan to the chat. Looks like we're tapped out of questions for today. So thank you so much for your presentation. And I love how much engagement and critical reflection is engendered with our participants today. So thank you again for joining us.
Thank you.
And thank you, participants, to joining us on this Friday morning. We'll wish you a safe and happy weekend, and I look forward to connecting with you again next month. Thanks, everyone.